right.
We're live again. We're getting ready to introduce Dr. Carr.
Yep.
She's going to talk about senior wellness, so here we go.
Here we go.
Hey guys. So I'm glad to see that you guys are back with us this week. Our topic is senior pets. So just like us, as we get older, we have more problems, and our pets do too, which can be kind of frustrating at times, but there's lots of different things to look out for in your senior pets that sometimes we just attribute to aging. Say, oh, well, he's getting old, he's slowing down, but he might actually have something going on, like arthritis, or sometimes hypothyroidism can make them kind of slow and just kind of sleeping a lot, things like that. But some things to look out for in your older pets that aren't, specific diagnostic-wise, but just some things you might notice at home that might, if you mention them to a vet, we would say, well, that kind of sounds suspicious for this or that. So obviously any change in behavior. Typically, pets do slow down as they age. They're not crazy wild puppies anymore. But if they're sleeping excessively, or you feel like they're having trouble actually being active, it's not that they don't necessarily want to, but if you've watched them going up and down the stairs and they really seem like they're struggling, it could be due to arthritis or something, or some sort of systemic condition that's causing them to be weak. So behavior changes, changes in intake, so food or water, either increase or decrease. So usually it's a decrease in food and an increase in water, things that people come in complaining about. And obviously if they're drinking more water, a lot of times they are also urinating more, which you may or may not be aware of, depending on what their bathroom habits are. So if you're out taking them out on the leash, you might know that they're actually going more. Or if they're having accidents in the house while you're gone and they've never done that before, you would realize that maybe they're urinating more. But sometimes I know it's really convenient to just have that doggy door where they take themselves out, and so you might not necessarily notice, but if they are drinking more water, chances are they're urinating more as well. So if you notice them drinking more water, it's probably a good idea to make at least a mental note of how many times they're hitting that doggy door to see if there's going to be any kind of increase in urination as well. And so if we see things like that, things we might be thinking about would be early kidney disease or diabetes, Cushing's disease, which is hyperadrenocorticism. Look that one up. Basically, a disease where they have a lot more endogenous steroids going on. So if you've ever been on a steroid, it makes you really thirsty, makes you have to urinate a lot, makes you pant. Maybe not pant, but feel warm all the time, which leads to them panting. What else besides, we talked about behavior, changes in intake, changes in weight, or so usually with older pets, usually with middle-aged pets, it's weight gain, and then sometimes in older pets, especially our feline friends, it's weight loss. And you may not even notice at first that they're losing weight, because it can be very subtle. But then, you notice after a while, well, that our cat's looking awfully skinny. She used to be this big old butterball, and all of a sudden I can actually, see her waist and things like that, and we haven't put her food back, so what's going on? Another thing to be looking out for in your older pets that is a very common complaint, because it's kind of offensive to people, is odors from their mouth or their skin, things like that. Skin problems are usually secondary to something else, especially in an older pet that's never had problems before. But it could be a primary issue. We have to be seen to know what's going on. But mouth odors, we always are concerned about dental disease in our older patients. Imagine what your teeth would look like if you didn't brush them for 9 years. Probably have some issues. But it can also be other things that are possibly more concerning than just their teeth. We do worry about cancer in our older patients, and sometimes mouth tumors can cause a really, really bad breath. So definitely, if you're noticing that in your pets, it would be great for you to bring them in and have them evaluated, make sure there's nothing more scary than just a little bit of stinky teeth going on. So what else? We have a lot of people that come in with their dogs. They're concerned about abnormal behaviors. So, and dogs can get a disease similar to like dementia or Alzheimer's in people. So it's called canine cognitive dysfunction. And things to look out for with that, there's kind of a syndrome of things. So your dog might not fall into all of these categories, but Things like reduced interaction with the pet owner. So maybe they used to be really in tune to what you were doing and really wanting to follow you around all the time, and now they couldn't care less about you, or they prefer to be off by themselves. Changes in their sleeping behavior. Usually we have people say, well, she's been waking up in the middle of the night, and she hasn't done that since she was a puppy. She's always been a really good sleeper, and now she seems to wake up in the middle of the night and be kind of confused about where she is. So reduced interaction, changes in sleeping behavior, loss of training, so things you may have trained them to do, especially potty training. So you may not notice that they're urinating any more frequently, but maybe they're trained to go into the door, and all of a sudden just don't know what to do, and they're having accidents in the house. It could be other things too, other behaviors that they're learned that they no longer wish to do, which may be dysfunction or may just be a stubborn old man. You never know. But usually we look for multiple of these things together to kind of put a picture together. So now that we've talked about some things to look out for in your pets, you say, okay, great, so now you've got me really scared that my pet has hypothyroidism, cancer, and renal disease. What are you going to do about it? So if you have noticed that they're showing any of these signs and you're now concerned, certainly aren't trying to scare you, just making you more aware. But if you are concerned, feel free to bring them in for an exam. And a lot of times in our older patients, we do recommend doing some lab work, blood work, and a urinalysis. We do offer a senior wellness screening panel, and it looks for a lot of these common things that we talked about: diabetes, renal disease, hypothyroidism. It won't specifically diagnose the Cushing's, which I'm sure you all Googled just as soon as I said it. But there will be things on the blood work as well as the physical exam that might point us to that direction, and we might do some further testing if we are concerned about that. Additionally, if you are, the blood work won't test for things like dental disease. That's something we see with our eyes, or arthritis. That's something we would also see with how they're acting and on the physical exam. But if we were wanting to possibly put them under anesthesia to clean their teeth, or put them on long-term medications for arthritis or something like that, we would want to have a baseline on their blood work to make sure that all their system was healthy enough to handle the medication. And if they were to develop a side effect from the medication, we could recheck the blood work and see kind of where we started and where we are now. So that's something that we would probably want to do for most of our senior pets, is just kind of get a check in there with them. Okay, now I've scared you and you're coming in and we've done the blood work and we've got the results back. And so I do want to let you guys know if you were to come in, the senior wellness lab work does get sent off to an outside lab. It's not something we run here at the clinic. So that's what we choose to do. So, say your pet, you have a concern, but your pet is stable, and we're not wanting to have the blood work results right this second. We'll send it off, and then we'll give you a call either later that same day, if it's in the morning, or the next day, and discuss the results with you. And hopefully we say, hey, everything looked really great on the blood work, and she's as perfect inside as she is outside, no concerns. But if there is anything we want to address with you guys, we'll obviously go over that at the time. As far as diabetes, we'll talk to you about managing with insulin and how that schedule works, things like that. Renal disease, we can go into detail with all of that as far as fluids and monitoring and things like that. But typically we recommend doing just the blood work every year for older patients, just to keep track of anything that might be, any subtle changes that might occur even before you notice any symptoms or clinical signs. But if we do catch something abnormal in the blood work, we'll likely recommend that you come in maybe twice a year to 3 or 4 times a year, depending on what it is that we're wanting to monitor and how well your pet is doing with whatever interventions we're making. So I'm going to pause now and see if Brittany and Ashley have gotten any questions that we need to answer.
Lauren had a question. What age is considered a senior?
Okay, so we define seniors here at Cahaba Valley Animal Clinic as any cat or dog over the age of 7. And that's a good general rule of thumb for most dogs and cats. But there are certain animals, like the Great Dane or some of these giant breeds, for instance, that age faster, their lifespan isn't quite as long. So a 7-year-old Great Dane is quite geriatric. So to be considered a senior as a Great Dane, we might be talking like 4 or 5. But for most pets and most breeds, 7 is a good rule of thumb to consider them a senior. Any more questions?
Is a dental healthy for, like, to be put under? Is that healthy for a senior?
Do they have to be put under one under dental?
Because dental health is important, right?
So that's a very good question. A lot of people are concerned about their older pets going under anesthesia, which is why we don't typically recommend that you just drop them off for dental without being first seen by a doctor. So, we want to evaluate the pet, listen to their heart and lungs, make sure from that standpoint they sound good and or appear healthy enough to undergo the procedure. And then we do require some blood work be done, either the senior wellness screening or in-house lab work, before we put a patient over the age of 7 under anesthesia, just to check their kidney and liver function, make sure they're able to process the anesthetic drugs appropriately. If we do see abnormalities on the blood work, that doesn't automatically mean we wouldn't proceed with the procedure, but we might make some adjustments in our anesthesia protocol just to make sure we're being as safe as possible. And yes, unfortunately, they do have to be put under anesthesia to get their teeth cleaned. I know everybody wants them to just sit in a chair and lean back like we do and get our teeth scaled, but unfortunately, they're not that cooperative. I really wish we could, start like a school to train them to do that. It would be so much easier for us, but they're really just not good at that. And if you guys are spending money on a dental cleaning, we want to be as thorough and complete as possible. So really the best way to get those teeth nice and clean and get clean under the gum line and everything is to have them under anesthesia. But obviously, if we had any concerns about it, we would not proceed, and we would discuss that with you guys if you brought your pet in.
Thank you for that question, Lauren.
Yes. That's awesome.
Alrighty, and what's another question that we had?
As far as senior health goes, are cats and dogs similar in the way that I guess the older they get, they have the same ailments, or does one have a different
breed?
Like say, do cats have more thyroid issues than a dog, or does a dog have more thyroid issues than a cat? Does it?
That's a very good question. So cats and dogs, obviously, both as they age tend to have issues, but not the same issues. They always told us in vet school, cats are not small dogs. They're very independent and they're very different, and we all need to recognize that. Yes. So as far as the thyroid issue goes, in particular, they both can have thyroid issues, but they tend to have opposite problems. So dogs get hypothyroidism or low thyroid, meaning they aren't making enough. Whereas cats get hyperthyroidism, or their thyroid is too high, meaning they're making too much. And that leads to different clinical signs in each of the species. So with low thyroid or hypothyroidism, you tend to get weight gain without any really increase in food or anything like that. Decrease in energy, they might be seeking warmth. A lot of times we see secondary skin issues as a result of hypothyroidism, just maybe their hair is slow to grow back, or you're seeing secondary skin infections, things like that. Whereas in our feline friends with hyperthyroidism, they tend to be, you can think about hyperthyroidism as just hyper in general. They kind of agitated, they've got an increased appetite, increased thirst, they might have vomiting or diarrhea, they tend to lose weight versus gaining weight, and they just have this voracious appetite but aren't able to keep weight on, and that's because their thyroid is really tied into their metabolism, so they're just kind of amped up. I know we could all probably have times when we wish our thyroid was a little overactive, but
Agreed.
But it's quite unhealthy for these patients, even though it might be nice to finally see that your overweight cat is losing weight. One of the major complications that we see with hyperthyroid or uncontrolled hyperthyroidism is a cardiomyopathy, or a problem with their heart, because their metabolism is amped up, so their heart's beating a lot faster and working a lot harder than it should have to, and then we can see secondary issues from that. Other things that we see shared in cats and dogs would be things like diabetes. Cushing's is much more common in dogs and cats, but it's definitely possible to have a cat with Cushing's disease. It's just not very common. Arthritis, heart problems, things like that. Dental problems are equal among the species, although it's much easier to look in a dog's mouth than a cat's. But that was a very good question about the difference between the two of them.
And Miss Jennifer Yates would like to ask, what food would you recommend for a senior dog?
Okay, depending on the dog, obviously, it can be different foods, but for just your general healthy senior that just needs like a maintenance food, I do recommend feeding a senior food, not an adult or a puppy food, because it's, it is formulated for them. So just a good quality diet. There's all kinds of diets out there, and I don't like to recommend any specific brands per se, just because there's so many, it's hard to keep up with. But just a good quality food, formulated for seniors, so meaning it's got good quality protein in it, but typically not as high of an amount because it can be harder on their systems. They don't need as much energy since they're not growing and they're not quite as active as they used to be. But definitely what you want to look for on a food label if you're, say, at a pet store or something, and most of the time it's good, but if you're at a pet store and you're not really sure, is this a good food or not? One, don't ask the salesperson. No, I'm just kidding. You can ask the salesperson. A lot of times they do have some good information, but sometimes they're just a high school kid who's paid to sell dog food. So whatever they say to you, take with a grain of salt. But look on the side panel and look for the AAFCO seal. So AAFCO is a organization that regulates the manufacture of pet foods. So if it has the AAFCO seal, then you know that the ingredients and the percentage of the different protein, carbohydrate, and everything has been evaluated, and that it is a balanced food that's good for maintenance, that you don't have to supplement with any additional vitamins or anything like that, because a commercial diet should have everything that your average healthy patient needs. Now,
grain-free, is that ideal?
Grain-free is fine. A lot of dogs tolerate it fairly well. It's not, strictly speaking, necessary just because the pet is a senior. Now, if you're having a pet that has some allergy issues, skin or food allergy with GI issues or whatever, grain-free is typically may work for those patients if they have a grain allergy. But it's not, strictly speaking, necessary for your average dog.
Thank you, Jennifer, for your question.
Great question. Great question.
Alrighty. I have a question personally. Okay. Older pets, do they have to have vaccines?
So that is an area of a lot of interest for people, and a lot of work has gone into studying exactly how long do these vaccines last. Do we need to do them annually? Are we doing them too often? So a lot of times in my older patients that have had several rounds of vaccines, and I know they should have a good immunity from those vaccines, we do still vaccinate, but we kind of spread out the interval. A lot of you guys are familiar with the 3-year rabies vaccine, and I think that's great, and it is recognized by Alabama as being a good vaccine and legally lasting for 3 years. So that's the biggest concern with rabies, is that it's illegal to be unvaccinated for rabies, so we need to make sure we're covering our bases there. As far as the distemper parvo vaccines go, I do usually spread those out to every 3 years as well in my middle-aged to older patients that have had a few series, just because the studies that have been carried out have shown that there's a duration of immunity of up to 7 years in some dogs. They haven't been carried beyond that because the funding for a study like that is very expensive. So no one's really sure exactly how long the antibodies induced by those vaccines last, but going every 3 years, you make sure you don't have a break in immunity, especially in an aging patient whose immune system may not be as robust as it used to be. You definitely don't want them not being covered. So they do still require vaccines, just not as frequently as in our younger patients. Thank you for that question.
You're welcome, Jennifer. Kiss the baby for us. Alrighty, do you guys have any more questions? You see anybody?
Anybody else have any more questions for the amazing Dr. Carr on senior wellness? She's covered a lot of topics, a lot of good topics that we get annually, because annuals.
Daily.
Daily.
How often should a senior come in? Should they come in once a year or twice a year?
Well, for most of our seniors, definitely at least once a year, if not twice a year. I know they're coming for their they're coming in for their vaccines, possibly if it's within that 3 years and it's time that they're due, but they definitely need to come for an exam at least once a year, even if they're not due for vaccines. Now, of course, we'd love to see them twice a year because things do change, as they age. Since their lifespans are shorter in general, 6 months can be a long time for them, and lots of things can change. So it's not a bad idea for them to have a semi-annual physical, even if you maybe haven't detected a problem, just so we can get our eyes on them, get our hands on them, and make sure everything looks just as good as it did 6 months ago. Now, for our patients that are undergoing therapy for one of these chronic diseases that we have talked about, they will be coming in at least twice a year, sometimes 3 or 4 times, just depending on what's going on.
Alrighty, and Stacy asked, what age is considered a senior in a dog?
In a dog or a cat, we say 7 years of age or older is a senior.
All right. Thank you, Stacy, for
Thank
that question.
you.
Alrighty, well, I think that wraps up
Wraps it up.
everything. And I
Alright,
hope you
guys.
guys have a good week, and we'll be back next Wednesday at 12 o'clock. If you have any more questions, just post them, and we will answer them, or you can send them as an email, or more than
Or you can even
welcome
call.
to come by.
Yeah.
The landline. Nobody else does. But.
We're stuck in the 90s, y'all.
You're welcome, Stacy. I hope you guys have a good day, and we will see you guys next Wednesday.
Bye.
Bye.